Welcome to the annual required compliance training. This training meets the requirements of the New York State Office of Medicaid Inspector General and the Federal Office of Inspector General. My name is Tom Zecker, and I'm the Compliance Officer for the North Country Initiative, the Accountable Care Organization, and the Independent Practice Association. Although this program was designed to meet the requirements of those three specific programs, this should also meet any of your organizational requirements as well. We have to keep in mind there's two sets of compliance regulations out there. We have OMEG, which is the Office of Medicaid Inspector General for New York State, and we also have OIG, which is the Office of Inspector General for the federal government. Both regulations are very similar in many parts, but they're also different depending on the area. And the one thing to keep in mind is one area could be more restrictive than the other. So when we're talking about regulations for this presentation, we're always going to default to the most restrictive regulation between the state and the federal government, as this presentation is generic. For specifics, please see your organization's compliance officer. So what is a corporate compliance program? Essentially, it's a formal program to ensure your organization is operating within all applicable laws and regulations. And why do we need one? Because A, it's required by New York State, B, it's required by the federal government, and C, it's the best business practice for organizations to eliminate fraud, waste, and abuse. Examples of compliance program focus areas include establishing an environment or culture that promotes self-monitoring, detection, and resolution of problems. We do this primarily by promoting ethics and integrity in the workplace, primarily through compliance training and education. We also track federal and state dollars to ensure that the money is not being connected to fraudulent behaviors and prevent fraud, waste, and abuse. So just saying that you have a compliance program, unfortunately, is not enough. There are required program elements that you must adhere to ensure that you have an effective compliance program that is required by both New York State and the federal government. So we're going to cover the 8 required elements of our effective compliance programs. Number 1, we have to have a compliance officer. Organizations must have an appointed and authorize a compliance officer. Compliance officers should have the appropriate authority to complete the required roles of that office. Number 2, you have to have policies and procedures. So organizations must have policies and procedures that are relevant and appropriate and must be reviewed and openly available to the employees. Number 3, you must have education and training. Organizations must implement a corporate compliance training program for all employees. Education must be done annually. Number 4, effective communications. You must provide a way for communications of violations and must provide a hotline with an anonymous way of reporting. Number 5, auditing and monitoring. You must conduct internal and compliance inspections, peer reviews, and external audits as required. Number 6, you must have a response. Have a system in place to responding to compliance issues that arise. Number 7, you have to have a disciplinary policy. Policies ensured a good faith compliance program participation and adoption. And number 8, we have to have a non-intimidation or retaliation program, which means if you're reporting an issue, you shouldn't have any concerns about being retaliated against because you reported such an issue. Program exclusions. This is what we call exclusion checking. So what is it? Essentially, it means that federal or state dollars through potentially Medicare, Medicaid, a state payer, a federal payer cannot be directed to an individual or an entity that has been excluded. Persons and entities must be checked against an exclusion checking list on a regular basis. This includes New York State OMIG list and the federal OIG list, as well as the federal SAMS list. So how do you get on one of these lists? By committing a sexual assault, by abusing a patient, diversion of controlled substances, failure to pay a HEAL loan or a student loan, or by committing just generalized fraud. Additionally, you can wind up on the exclusion checking list for males if you don't register for selective service. So when we talk about fraud, we're specifically talking about kind of the False Claims Act. And essentially, this is facilities or individuals that are billing for services they didn't provide, or they're inflating the cost of the services they did provide. So one of the other items we have to talk about is kickbacks, what we commonly think as a kind of a quid pro quo situation. And essentially, you can't give kickbacks or monetary influences for referrals of patients. One of your moral and ethical responsibilities is to report concerns of suspected or alleged noncompliance. You can do this in many mechanisms, including making an anonymous reports. Just remember, if you have any doubt, make sure you make a report. So how do you make a report? You can do this in a couple different ways. You can simply report this to your supervisor or your manager. You can report this to your company compliance officer. And you can also report this to the NCI, ACO, or the IPA compliance officer, which is myself, Thomas Zecker. You can call me at any time at 315-755-2020, extension 23. You can send me an email at tzecker@fdrhpo.org, or you can use the link provided to file an anonymous report. This compliance training meets the minimum requirements. Please ensure that you follow your organization's compliance program that specifically covers unique aspects of your organization. If you have any questions or concerns, please feel free to contact me at my provided contact information. I appreciate your attention, and we'll talk to you next year.